rare, manageable complication with an incidence of 0.06%.
A very good afternoon, respected chairpersons and my dear friends and seniors. Patellar complications are well known to occur after total knee replacement, and they have been reported variably in the past, ranging from 1 to 20%, including maltracking. Other complications like pain and fracture and osteonecrosis have also been reported. However, these studies are from the 80s and the 90s, after which considerable strides have been made in the implant designing industry. So they are relatively few right now in our present scenario. The various factors which are important and could account for the maltracking and subluxation include internal rotation of the tibia and the femur, residual valgus at the femur or at the knee per se, and the patellar thickness which has been inadequately trimmed, or capsular dehiscence which can be seen among others. It has been an age-old battle to whether to resurface or to not resurface the patella. However, a newer concept which has emerged is reshaping or debulking it along with circumferential denervation. The results of resurfacing and non-resurfacing in terms of subluxation have not varied significantly. And the management which has been followed in the past is whether we have, depends on whether we have a well-aligned implants in terms of femur and the tibia, or whether the implants are malaligned, in which case total knee revision, total knee arthroplasty has to be performed. So here we are presenting two cases of patellar subluxation which had occurred in our institute. Just before that, just a note on the subluxation, just a couple of angles that we use. It's a patellar tilt angle that measures the inclination between the equatorial patella and the anterior flanges, which is normally less than 15 degrees, and the lateral shift, which is usually less than 30%, and a posterior shift of the patella from the anterior aspect of the lateral condyle. Earlier, it was reported that these complications did occur in almost 22% of the knees that were 1 to 5 years post-surgery, and which had higher preoperative variables, including these angles. And they are being shown to progress sequentially with follow-up and affect the lateral part of the patella in terms of erosions. So we, at our institute, perform a debulking and denervation for all our patellae. And the first patient is a 66-year-old lady who came 3 years after her knee replacement with a 6-month history of left knee pain and instability and difficulty in climbing down steps. Examination findings were consistent along with radiological findings of a subluxated patella. And we took her up using the same incision, did a lateral release, denervation, and debulked the fibrous tissue and performed a debulking of her patella. And for 4 weeks and 6 months follow-up was good, and she's been walking with her without support now. The second patient is another 66-year-old lady who had, within a month this time, a painful locking episode of her left femur when she was flexing from a fully extended position. Again, radiological parameters were consistent with the patellar subluxation. And intraoperatively, we did the debulking carried out similar to the previous procedure, and it was confirmed with a no-thumbs test that the patellar tracking was intact. At 3 months follow-up, she's able to perform her activities of daily living without much discomfort. So from our center, we have reported these 2 cases. Over the last 2 years, where over 3,000 knees have been performed. These complications had been in literature variably reported. In this study from Wang and colleagues, it was only around 1% of incidence of patellar subluxation that would have been managed by a release, and malrotation could be corrected. Now, whether malrotation of that is internal rotation of the femur and the tibia are contributory to this problem has also been debated in the past. Our cases were of increased patellar thickness in the first case, and a capsular dehiscence, probably by a over-enthusiastic physiotherapy or by the fall that she was seeing. And the results of lateral release which we had performed have been gratifying in the past. And we do understand that it's an isolated case report of 2 cases, considering the rare occurrence. And there are different designs. One we had to use a striker, the other one was a Smith & Nephew implant, and it's difficult to derive recommendations based on these isolated reports. However, it is a complication that can be tackled by performing a retinacular release, and the short-term results appear gratifying.